Hello and welcome. For the last several weeks, we've had an opportunity of speaking to one of the finest minds in the country. Dr. Randeep Guleria is director of the All India Institute of Medical Sciences and very much leads the fight with some others in terms of finding a way forward in dealing with COVID-19. He's been looking at the situation very closely in Gujarat. He's been looking at some of the possible cures in the future which may arise and what the symptoms are actually showing, what the disease is actually showing in hospitals around the country. He joins us now. Thanks, Dr. Guleria, for being with us. One of the words I've seen being spoken about quite a lot in the last few days is herd immunity. That you can't beat the disease in the way we are trying to beat it now, and that herd immunity is the way forward. Is that the only way forward?
So herd immunity is one way that you can try and beat the disease in terms of decreasing the numbers by saying that now you have a large part of your population which has developed immunity to the disease, and thereby they will not get infected, or if they get infected, it will be a very mild infection. So getting herd immunity, you can get it by two means. One is, of course, about 50% or more of the population gets infected and therefore they get antibodies which protects them. This is something which is going to be pretty difficult and is going to take a long time. The other is by vaccinating a large number of the population so that they develop immunity through the vaccination and are able to get herd immunity. In my mind, herd immunity could be one mechanism, but there are two riders. One is it's going to take a long time, and we don't know how much immunity this virus gives in terms of its duration of immunity. So you may have an immunity which may last for a few months, and by that time you may again be predisposed to getting the infection again. So since it's a new virus, we are still learning about how effective is herd immunity going to be, or the so-called immunity passport that is being sort of said that one can use. It's still not very clear whether it's going to be effective in the long run.
And what about potentially older people being affected? Is that the big worry of herd immunity, that there are those who may not be able to tolerate the virus at all?
Correct. So the challenge, I think, currently is not in terms of the numbers, because as we see it, if you look at the younger age group or the younger population, even if a large number of people get infected with COVID-19, they come out and they become all right. We have almost 80% of people who are asymptomatic and become okay. The challenge actually is the mortality. We have to make sure that our deaths don't go up and our hospitals don't get crowded or overfilled with critically ill patients. And there are two sets of people who are the ones who can really fill the hospitals or become very sick. One is the elderly, those who are of the older age group, and the mortality and the seriousness of the infection goes up with each decade of illness after the age of 60. And the secondly is those with comorbidities, those who have heart disease, hypertension, diabetes, who have underlying chronic lung diseases or chronic kidney disease. Their immunity is low and they are also predisposed to have a severe infection, which can lead to a higher mortality.
Yeah. Doctor, the Oxford vaccine, which we've spoken about in the past, the vaccine candidate, I should say, has been tested successfully on monkeys. What does that potentially mean in terms of its development to hopefully being a cure?
So that's one step. If you have a vaccine, first you really see that does it produce antibodies in sufficient amount. But remember, this is not in humans, this is in monkeys. So then you have to really see in terms of human trials that in humans, is this vaccine actually producing sufficient amount of antibodies to really give good protection? You may have vaccines, and as you know, there are almost 100 vaccine candidates, but you have to see which are the ones which can produce a good amount of immunity in the body of a human being so as to be protective. Then the second important thing is that the vaccine has to be safe. It has to be safe so that healthy people who get the vaccine don't get side effects. Many years ago, a few decades ago, there was a vaccine which came up and it caused a lot of neurological problems. There was a fear that it was causing some degree of neurological problem. It could be related to the vaccine or the adjunct that is added onto the vaccine to increase its potency. Okay. So I think it's important to remember that that is the second step that we need to really go through when we are looking at vaccine development.
Sure.
Now, if we presume that we've crossed these two steps, that we have an effective vaccine, we have a safe vaccine, then we come to the third step of large-scale manufacturing. And that becomes also a challenge because you will need to have a large-scale manufacturing. You're looking at huge amount of doses, millions and millions of doses if you want to really vaccinate a large amount of population. And here again, what usually happens is you land up prioritizing the vaccine when it comes in the first lot. We saw that happening with H1N1 when that vaccine came during the 2009 pandemic. So I see a lot of challenges down the road as we go on to vaccine development.
And doctor, therefore, do you believe that the progress shown by remdesivir in the United States is something which can bring relief faster and before a vaccine comes into the market?
So I think before we look at the vaccine, because the vaccine in my mind will be available earliest by next year. If we really say push things, it could be the first quarter of next year if we're lucky. We get a vaccine which is effective from the very beginning. But the challenge is that during that time we have to have some effective treatment strategies. Currently we don't have an effective treatment strategy. Remdesivir is one drug which has shown potential. I would say that the data currently is very limited. It's just shown that it helps in decreasing the hospital stay. It's not a mortality benefit. The strength of any study would be that it shows that it actually decreases deaths, that it is able to decrease the number of people dying when that drug was taken. The current data is not strong enough to show that for remdesivir, but there is an indication that it may be useful. We need more data, but we currently have nothing else available. So it's either remdesivir or hydroxychloroquine or an anti-HIV drug or convalescent plasma that one can really think of.
Yeah. This is the question you'd be asked all the time. When will India flatten the curve at the present rate?
So it's a difficult question to really answer because it depends on how things evolve over the next few weeks. The curve is to some extent satisfying that although the number of cases are increasing, there's no huge spike in the number of cases. And what is also sort of satisfying is that the hospitals are not sort of getting full of patients, and we have a large number of patients who still have mild infection. So I would say that even if the curve stays relatively flat and it doesn't really put a huge strain on the healthcare resources, we still would be sort of lucky, but we need to keep working aggressively, especially in the hotspots, to decrease the number of cases so that we are able to get the curve to sort of stay flat and start showing a downward trend.
So this is a related question. Why has India overtaken China in overall cases despite having had the lockdown for so many weeks now?
So I think there are multiple factors. We are in our population, there are pockets which are really very, very crowded. We've seen what happened in Bombay, what's happened in other cities. And the challenge of controlling people is more difficult. A lot of challenges that we have in our country are different. We are a democracy, and therefore it gives people the right to do things which may actually not be correct from the point of view of infection control. We've seen migrant laborers traveling huge distances. We've seen people who are, I would say, well educated, having parties and not really following the norms of social distancing or as we should. These were something which could be implemented more aggressively, I feel, in China. We have not been able to do it because I think we as citizens have not been as responsible as we should be.
Yeah. Another question which came in earlier today is on the medical aspect. How important is the COVID detection kit made by Roche, which claims to be 100% accurate?
So the kit that is coming is basically, we have to, and I think it's important to understand this because it's created a lot of confusion. We have a kit which is for the detecting the virus, which is the RT-PCR kit, which is a nasal or a throat swab, which tells us currently whether you have the virus in your body and whether you are infectious or not. It may not really give you an idea whether you're infectious or not, and I'll come to that in some time. So if you are wanting to see whether a person who comes with fever and has fever only for 4 or 5 days, has cold, cough, body aches, classical symptoms of COVID-19, the gold standard of the test that is to be done is the RT-PCR test, which is the nasal or throat swab. Then now we have antibody kits available, which are ELISA based, which is made by Indian companies also. NIV Pune made a kit. Roche has one kit. Other companies also have a kit. Abbott has another kit available. These are very high-end kits which are able to detect antibodies early in the blood. But these antibodies usually start appearing only after 7 to 10 days. What we've shown in most of our data that we have limited data of patients who we had in the early part of this pandemic, that these antibodies in our population actually even form later on, maybe after 2 weeks. So the utility of the serological test, the ELISA-based test which Roche has, is going to be predominantly to really look at the antibodies which an individual has, for which he has recovered. Roche also has another machine which is a high throughput machine, which is again the RT-PCR machine. The advantage of that is that you can do almost 1,000 tests a day or more than that in a day if you run it 24/7. So that gives us the capacity to hike up our test, but the tests remain the same. So you have the RT-PCR test for the first few days, and you have the antibody test which tells you that you've had the infection, you have recovered, you may have had it in the past, which gives you an idea of serosurveillance. It's not a diagnostic test. Right. The third thing that you must remember, if I may just add one more thing, is that our discharge criteria has changed. If you remember in the past, we used to say that after 14 days, you have to get your throat swab done again. And if the throat swab is negative, then only are you sent home, because then you say you're infection free. But over the last 2 weeks, a lot of data has emerged which suggests that after 10 days of having the infection, or if you're all right for 3 days, even if your nasal swab RT-PCR is positive, the virus is not viable. It is actually a dead virus. It's just lying in your throat, and you cannot culture it. It doesn't grow on a culture medium. And that is why the policy now is that you don't need to get tested. If you're all right after 10 days, you can go home. You are not infectious and you're safe. So I think as we are learning about how this virus behaves, our strategy changes on a regular basis. And this gives us the capacity to really discharge patients early without worrying that they could spread the disease in the community.
Yeah. Doctor, earlier on the world felt that this was an illness which didn't really affect children under a certain age. But then you've got these cases in America linked to the Kawasaki disease.
Correct.
So what exactly is that, and are our children in India equally vulnerable?
So I think the first thing is that although children are less affected, it's not that they are not infected. Currently in our own hospital, we have 2 children who are actually admitted and who are COVID positive. One of them is just 1 year old, and we're having this issue because how to really manage this child in the hospital, because the parents are not positive. And then how do we provide a caregiver to a 1-year-old child who is positive, but the mother is not positive. So these are challenges that you have. But there are children who are actually positive, and we've seen that in our hospital over the last few days. The Kawasaki syndrome, which is being reported more from the US and from Europe, is basically an acute inflammatory syndrome which happens. What is interesting is, and this is based on limited data, but it's not being reported that much among the Asian population or the Asian kids that have children that are getting COVID-19. But it's still early days. It's important to just keep an eye and keep observing and having a high index of suspicion, because this is an atypical presentation, and sometimes unless one suspects it, one could miss it in terms of making a diagnosis.
Doctor, I was fascinated to hear what you were saying about that 1-year-old with COVID. The parents aren't infected. How do you deal with a situation like that? Because at that age, the child needs to be with the mother. So how do you deal with that situation?
So the situation is to talk to the mother and give her a personal protection equipment, get her protected and let her go into the ward to look after the child. That's what we are planning to do.
Doctor, you can't, obviously there's confidentiality for everybody, but is that child okay? I mean, is the child...
The child is okay. The other good thing is that most of our children who are positive, and we've had children with heart disease, one child was admitted actually for a complex cardiac disease for surgery, turned out to be positive. In that child, both the parents were also positive, so this issue wasn't there. So it was a semi-emergency surgery, we've had to postpone that. And now we're waiting for the child to become negative before we take that patient up for a complex cardiac surgery. So children, by and large, that we've had have actually been all right.
Doctor, keeping up the spirits of children must be such an important task for nurses, for doctors. We don't talk about that at all. All that you and I have been talking about is the disease. But there's a certain humanity in hospitals. And as the director of India's largest hospital, how do you focus on that? For example, children or those who are old, who are confused.
I would say it's a huge challenge because, for example, these children are all right. So how do we manage them in an isolation facility? We have to be innovative, maybe even give them some toys that they can play with and stay busy, because it's something which is difficult for them to stay in a quarantine facility or an isolation ward with sick patients all around. Similarly, for the elderly, when you have an elderly person or a person who has to stay isolated for 14 days, if you talk to them, any mild symptom they have, they worry that this could be life-threatening. They are not able to, they're worried about how do they communicate, what do they tell their family members, and the fact that could they have given the infection to their family members. So there is a lot of stress which is also involved, which we actually don't really sort of talk about, but we must understand that patients who are otherwise healthy, having to stay in hospital for 14 days creates a lot of anxiety and stress in them.
Yeah. Here's another question. Should salons be allowed? Should salons be allowed to open?
So this is a question which we need to really have a issue on where exactly we are looking at them being allowed. Is it a green area or a red zone? Not at all at a red zone. Salons, you have some degree of close contact, and you will have to develop strategies for taking protection while things are being done, like a haircut or other things like a massage. You will have to have a new normal which will have to be created as far as these things are concerned. Maybe something that could be considered where cases have come down significantly or in the green zones, but with a lot of precautions. Would be difficult to say that this should be done in the red zone.
Right. Is it too early, in your opinion, to restart metro train services and public buses?
So again, this is a decision which will depend on multiple factors. From the health point of view, even if one wants to do it, one will have to be very, very cautious in terms of social distancing, in terms of decreasing or having a limited number of people who can travel, and again observing in terms of the number of cases. The worry as far as health professional is concerned that we have to be very disciplined when we start using local transport. We can't go back to what we were doing in the past in terms of the crowds that we had in, say, in the Delhi metro or the Mumbai trains. That can be something which can be very dangerous and may actually lead to a resurgence of the infection because of that. So it's a balance of how do we get the economy back to normal or kickstart the economy. At the same time, how do we stay safe in terms of infection control and public health measures?
All right, Dr. Randeep Guleria, pleasure speaking to you. Thank you very much for speaking to us, sharing your thoughts on where we are this week as far as the pandemic is concerned and how we are dealing with it. Thanks very much indeed.
Thank you. Thank you.